vomiting, continuous dialysis, you know, mechanical ventilation, all these dangerous, dangerous medical procedures. And they put their life on the line and without the proper equipment. And there's nothing.
You believe Nurse Pham was wearing that kind of equipment when she was exposed?
They know she was because the equipment we needed was still on order.
Well, the hospital is not to Brianna's accusations, but earlier today, they did respond to the broader allegations from that union, National Nurses United. Now, the hospital says when Mr. Duncan returned to the hospital the second time, he was moved directly to a private room and placed in isolation. They also say nurses who interact with Mr. Duncan wore protective equipment consistent with the CDC guidelines at that time. Joining me again, Chief Medical Correspondent Dr. Sanjay Gupta, also Dr. Seema Yasmin, the staff writer for the Dallas Morning News and a former CDC disease detective. Sanjay, I mean, it's something to hear what Brianna has to say there. The lack of training, the protective gear with the neck open, being told to put 1-inch medical tape on their necks. It's not like hospitals in the United States didn't know Ebola was out there. I mean, and hadn't seen what Doctors Without Borders and others were doing to deal with it in terms of protective gear. Shouldn't they have been prepared?
I mean, and no question, Anderson. There's several problems, obviously, that she outlined really well. Two big ones. First of all, the gear itself. What was available, what was not available, the training that on and off. It's all easy. It looks simple. There's some steps to it that should be trained and drilled. But the second part of it is that even if you followed the CDC guidelines on Ebola, it left a lot of exposed skin, and that's quite concerning. We talked about this, Anderson. Take me a picture. I want to show you. I got an exclusive look inside what Emory uses to basically try and protect their doctors versus what she was just describing. Look, I mean, this is Dr. Bruce Ribner. He's the lead man on the 5-member team that has been taking care of patients here at Emory. They go above and beyond what the CDC recommends. But you can't see his whole body there, but take a look specifically at the neck, take a look at the hood, the face shield. That's the point. You don't want anything exposed. It's not a respiratory virus, so you don't need respirators, but you need what he's wearing there. They have it here. That's what they're wearing, and it sounds like she did not.
Dr. Yasmin, what do you make of what Brianna has said?
I think she's a brave woman, but she's really speaking on behalf of many healthcare workers here in the US. We've heard from so many that they asked, why are we looking at doctors in West Africa who are treating patients with Ebola, and we don't see any exposed skin?
But
they're wearing completely
she's
covered
speaking
bodysuits,
for
they're wearing hoods and face shields, but yet here in the
this is
US, the
someone who
guidelines are very piecemeal.
thinks
You
she
put on a
could
mask,
do
you
it
put on a pair
better,
of gloves, a
right,
gown,
Allison?
and then you may or may not put on another pair of gloves and the booties. So we're seeing very different guidelines being instituted in different hospitals
Even in a
across the US.
crisis, people
And I mean,
compete.
Sanjay, you made this point, I think, a couple days ago, when the head of the CDC was visiting in West Africa,
Reward.
he wasn't wearing what the nurses in this hospital were wearing. He was wearing that full protective suit, correct?
Correct. And, you know, he was doing what all the doctors do there. I should point out that sometimes you hear that we're making a distinction. If you have direct contact with the patient, you're actively taking care of it, it's a different level of protection as opposed to if you're just in the room. Keep in mind, when he was wearing that full content, he was touring an Ebola ward. He wasn't actually actively taking care of patients, and yet he was fully covered from head to toe. So there is this double standard there. And to be fair, that may have been the only equipment they had there where he was in West Africa. They may not have had the other options, but still, this is not that complicated. If this can transmit through the skin, bodily fluid that's infected gets on your skin, you get the infection, you cover your skin. Taking care of a patient, you cover your skin. It sounds silly almost saying this over and over again.
And Dr. Yasmin, I mean, I think, these nurses, if you're a nurse, nurses want to help people. You're in a room with a patient who starts projectile vomiting or having, diarrhea. They're going to want to try to help. And the idea that not everybody has the same level of protection if they're in the room with patients seems bizarre to me.
Absolutely, and Anderson, nurses are some of the most hard-working people in the hospital and some of the most underappreciated, and they are absolutely there to serve. They want to care for patients, but they also want to make sure that the hospital has their back and that they're going to be safe while they do their job.
We're going to hear more from Brianna in our next hour on 360. She's worried about keeping her jobs, and we're going to try to get a response from the hospital on that. Just ahead, what we now know went on inside that hospital, and what we now know about Nurse Amber Vincent's trip to Ohio and back right before she was diagnosed with Ebola just this past Saturday. She was planning her wedding in her Ohio hometown, stopping by a bridal shop Then she flew back Monday and was in the hospital the next day. The latest from Ohio next.
She stopped by to put a bridal business.